Why did my eyelids droop over time?
We routinely see people in our office who are concerned about the appearance of their drooping eyes. They frequently express having difficulty keeping their eyes open, particularly as the day progresses. Some of these patients will describe straining to keep their eyes open while driving for an extended period of time. I often see patients who come in after having Botox treatments for their forehead lines only to discover that their eyes appear to be smaller after their treatment. These same patients are surprised to learn that the lines in their foreheads were getting deeper because they were straining to raise their eyebrows unconsciously in an effort to open their drooping eyes. The Botox injections in actuality revealed how low their upper eyelids were all along. They often assume that their drooping eye appearance is due to the presence of excess skin weighing down on the eyes, which would be an indication for cosmetic upper eyelid blepharoplasty, where this excess skin would be removed. Although blepharoplasty may be helpful, removal of excess skin alone will not address another common issue called upper eyelid ptosis. The diagnosis of upper eyelid ptosis is made by looking at specific measurements of the upper eyelid position relative to the center of the eye or the pupil. If the upper eyelid is closer to the pupil than it should be, we refer to this as eyelid ptosis. This means that if you don't recognize the presence of ptosis and undergo upper eyelid blepharoplasty alone, you'll still feel like your eyes are drooping and that you still look tired afterwards. There are different causes for eyelid ptosis. I'll discuss the more common causes for ptosis, which we see a lot of in our cosmetic eyelid surgery practice, and what we do to help our patients look and feel better. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial plastic and reconstructive surgeon. I have been in practice in New York City and Long Island for over 25 years. I perform a wide range of cosmetic eyelid procedures in my practice. For example, I help people with under-eye bags using a specialized technique where there is no incision on the external or on the eyelid skin. I treat hooded upper eyelids. I also specialize in creating natural eyelid creases for what's commonly referred to as double eyelids for patients of Asian descent. Amongst the other advanced procedures I perform, I help patients with conditions such as thyroid eye disease or Graves' disease, and I perform revision surgery for complications of cosmetic eyelid surgery performed by other surgeons. Eyelid ptosis can affect one or both eyes, which is referred to as unilateral or bilateral. Eyelid ptosis can be present when you were born and is referred to as congenital ptosis. Eyelid ptosis that occurs after you were born is referred to as acquired ptosis. Generally speaking, apart from neurologic causes for ptosis, we determine treatment strategies based on certain characteristics of a muscle that lifts the upper eyelid called the levator muscle. The levator muscle, which is spelled like the word elevator without the letter E. I typically see people who noted that their eyes appeared to have become smaller when they looked at photos of themselves. They often report that they have some of the symptoms I mentioned earlier, such as eye fatigue as the day progresses. Although conditions such as thyroid eye disease is typically characterized by upper and lower eyelid retraction or the eyes appearing too open, there are some situations in people who have Graves' disease where the upper eyelid can droop resulting in upper eyelid ptosis. Acquired ptosis can also happen due to an injury, such as a motor vehicle accident, where significant swelling can cause permanent stretching or detachment of the levator muscle. Ptosis can even occur after routine cosmetic upper eyelid surgery. This situation can be due to swelling post-surgery or from the surgery itself. Sometimes it occurs when someone already had a degree of ptosis which became worse after upper eyelid surgery was performed and the condition became more obvious. Generally speaking, I see a lot of acquired ptosis caused by age-related changes to the levator muscle. This typically means that the tendon of the muscle referred to as the aponeurosis has stretched or has separated, resulting in the upper eyelid displacing downwards. I also see a lot of patients who are aware that they've had sleepy-looking eyes since they were younger and that their eyes drooped more as they got older. Acquired ptosis is typically best managed with surgery. Eyelid ptosis surgery is deceptively complex and is not routinely performed by plastic surgeons who haven't done specialized training in oculoplastic surgery. Although eyelid surgery ranks every year in the top 5 cosmetic procedures in the United States, it's far from a type of procedure performed with a consistent and uniform technique amongst surgeons. A systematic approach to diagnosing the presence of ptosis and having a clear understanding of what the cosmetic results are likely to be is critical to having a successful outcome. When it comes to treatment planning for any procedure, my approach is to minimize risk, to achieve great results, and for you to have a quick and uneventful recovery. Surgical risk is generally minimized by having a high level of technical proficiency and working with a team of skilled assistants in a dedicated facility. For example, we're all familiar with hospitals that specialize in orthopedic surgery or laser vision correction centers. In the same spirit, in our offices, I designed my own surgery facilities to my specifications, so I and my team have the most control in performing the technical aspects of your procedure in the best way possible. As far as the actual surgery is concerned, I often perform ptosis surgery by working on muscles that lift the eyelid from the underside of the upper eyelid. This approach has worked consistently in my hands. Working from the underside of the eyelid is particularly effective when you don't have the need to perform any skin removal, making recovery even faster. I also perform other types of ptosis surgery from the front of the upper eyelids, such as levator muscle advancement, as well as procedures where there is no levator muscle function, referred to as a frontalis sling. I also focus on reducing risks to your health and recovery through the type of anesthesia we administer for your comfort. We do this by not using general anesthesia. General anesthesia is the method where you are unconscious and paralyzed during your surgery. In this situation, you need a tube in your throat for you to breathe with the assistance of a mechanical respirator or ventilator. Common side effects from general anesthesia include nausea, vomiting, constipation, and longer recovery time. In distinct contrast, I routinely perform cosmetic eyelid surgery and ptosis correction using local anesthesia with light IV sedation. Our patients are comfortable throughout their surgery and feel good immediately afterwards. They typically require no pain medications or skilled nursing care during their recovery. I routinely see our patients after 1 week when they're generally able to go back to work with minimal bruising, as well as minimal swelling. The objective of cosmetic eyelid surgery is to help you look less tired and to have a more vibrant appearance. If you don't recognize ptosis being present, you won't realize the full potential you have to looking your best. A proper evaluation where acquired ptosis is identified and addressed can have a significant impact on how you look and how you feel. I hope this information from my experience helped you. If you are interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.